Assalamu alaikum. Today, the topic of my video lecture is congestive heart failure. What is congestive heart failure? It is a condition in which heart is unable to pump blood at a rate required to meet the metabolic demand of body's tissues and organs. Heart failure can be systolic heart failure in which the heart cannot pump blood, and it can also be diastolic heart failure in which the heart cannot fill properly. As a result, the blood it accumulates in the lungs, congestion or fluid buildup occurs, and hence we call it as congestive heart failure. The mechanism by which congestive heart failure occurs is as follows. The cardiac output is decreased, so as a compensatory mechanism, neurohormonal activation occurs via sympathetic nervous system activation and renin-angiotensin-aldosterone system activation. By sympathetic nervous system activation, vasoconstriction occurs. As a result, the afterload is increased, BP increases, and cardiac output is maintained. By the activation of RAS system, vasoconstriction occurs along with sodium water retention, increased preload and afterload, and cardiac output is maintained. If these compensatory mechanisms fail to occur, we get congestive heart failure. Now coming to the causes of congestive heart failure, we have systolic dysfunction and diastolic dysfunction as I've mentioned before. So we have separate causes for each. The causes for systolic dysfunction are ischemic heart disease, hypertension, valvular heart disease, dilated cardiomyopathy, myocarditis, hemochromatosis, alcohol, and thyroid disease. The causes of diastolic dysfunction are hypertension, valvular heart disease, hypertrophic cardiomyopathy, restrictive cardiomyopathy, constrictive pericarditis, and cardiac tamponade. Now coming to the clinical features of heart failure. Heart failure can affect the right ventricle as well as left ventricle, causing right heart failure or left heart failure respectively, each of which can have systolic or diastolic failure. First, we'll discuss the left-sided heart failure, which is the most common type of heart failure. It is usually due to systolic or pumping dysfunction. It is known as a forward failure because left side of the heart cannot eject blood into aorta. As a result, the left atrial pressure as well as pulmonary venous pressure is increased. And also, it can increase the fluid moving into the interstitial space, thus leading to pulmonary edema and congestion. Now, let me discuss few mechanisms and few causes of left-sided heart failure. The first can be ischemic heart disease due to coronary artery atherosclerosis that damages the myocardium, so it cannot contract forcefully or pump blood efficiently. As a result, less blood passes through coronary artery to heart tissue and it damages the myocardium further. The second cause may be long-standing hypertension due to which the arterial pressure increases in systemic circulation. It gets harder for left ventricle to pump blood out. As a result, we have left ventricular hypertrophy, which squeezes coronaries as well as increase the oxygen demand. Due to these two, some muscles have weaker contractions that can lead to systolic failure. The third cause can be dilated cardiomyopathy, due to which filling of ventricles occur with larger volumes of blood, that is, preload is increased. As a result, the contraction strength also increases. The muscles they get thin and weak, and systolic left-sided heart failure occurs. Now, the signs and symptoms apart from pulmonary edema and congestion are as following: dyspnea, orthopnea, that is dyspnea on lying flat, paroxysmal nocturnal dyspnea or PND, which is dyspnea at night. Third heart sound is audible. Bibasilar inspiratory crackles on chest auscultation, mitral valve regurgitation. Now, some of the medications used specifically in left-sided heart failure are ACE inhibitors that dilate the blood vessels and correct the heart failure to some extent. And the second are diuretics that reduce the fluid buildup, thus reducing the pulmonary edema and congestion. The detailed treatment of the heart failure will be discussed at the end of this video lecture. Now, coming to the right-sided heart failure, it is known as backward failure because right side of the heart cannot pump blood from venous system to lungs and therefore blood accumulates into the venous system. The signs and symptoms of right-sided heart failure are jugular venous distension, painful hepatosplenomegaly, cirrhosis that ultimately leads to liver failure, ascites, pitting pedal and pretibial edema, tricuspid valve regurgitation, and third and fourth heart sound are audible. The treatment of right-sided heart failure also includes ACE inhibitors and diuretics, and the detailed treatment of right-sided heart failure will also be discussed at the end of the video lecture. Now, coming to the investigations of congestive heart failure, the first investigations include blood tests that may include CBC, urea creatinine electrolytes, liver function tests, thyroid function tests, cardiac enzymes, and beta natriuretic peptide. The second investigation is chest X-ray, and the findings may be of cardiomegaly or pulmonary edema. The next investigation is ECG, where we have findings of ischemia such as left ventricular hypertrophy or previous MI, findings of heart blocks, or findings of arrhythmias. Next comes the echocardiography, which distinguishes between the systolic dysfunction and diastolic dysfunction. We have two kinds of echo. The first one is transthoracic echo, which is best for congestive heart failure, and the second is transesophageal echo, which is accurate for evaluating the heart valve function and diameter, and it is not necessary for evaluation of congestive heart failure. Now comes the management for congestive heart failure. We have a separate management for systolic dysfunction and diastolic dysfunction. In systolic dysfunction, we have further pharmacological and non-pharmacological management. The pharmacological treatment includes ACE inhibitors or ARBs, beta blockers, diuretics, hydralazine that decreases the preload, and nitrates that decrease the afterload, ivabradine, and digoxin. The non-pharmacological treatment includes cardiac resynchronization therapy, implantable cardiac defibrillators, ventricular assist devices, and cardiac transplant. The diastolic dysfunction, on other hand, includes the medical treatment only, that is diuretics, beta blockers, and vasopressors such as epinephrine, etc. The last is complications of congestive heart failure, which include hypokalemia, hyperkalemia, hyponatremia, impaired liver function, thromboembolism, atrial and ventricular arrhythmias. Thank you so much. This was all for the topic of congestive heart failure. For more videos, kindly subscribe to my channel. And for the diagnostic criteria of heart failure, I will make another video on my channel.